Okay, the next case scenario is about hypothesis testing, and it is a clinical trial conducted to determine the role of cerebrospinal fluid, beta-amyloid levels as a biomarker in the early detection and prognosis of patients with Alzheimer disorder. 100 participants of the patients enrolled, and they underwent for a questionnaire for many mental states examination score, which is a usual scale to measure the cognitive abilities within the participant. And the researcher divided these participants into three groups. Mild dementia if the participant got from 20 to 24 points in this scale, moderate dementia if the participant got from 13 to 20 points, and severe dementia if the participant got less than 13 points. Participant CSF level then is measured, beta amyloid 42 is measured by immunoassay, and the level, which is continuous variable for sure, the researcher found out that there is a statistical significant difference in the CSF levels of beta amyloid 42 between the groups, the mild, moderate, and severe. Which of the following statistical test was most likely used to compare the study groups? And to answer this question, it is crucial to know, first of all, what type of the variable that they use. The level of beta amyloid protein 42 in their immunoassay, which is it continuous variable or categorical variable? And it is for sure continuous variable. So I'm talking about the mean of the beta amyloid 42. And the second thing is how many groups that I have in this question. I have mild, I have moderate group of dementia, and have severe group of dementia. So three groups. And what is, in other words, the question asking me, so now I have the main variable that I'm using, it is a continuous because I'm looking for the mean level of beta amyloid 42, and among the three groups, mild, moderate, severe dementia participant with this disorder. So in other words, the question asking me, what is the best statistical test that I use to detect the mean differences of beta amyloid 42 between three groups, which is the categorical variable for sure? In that case, the best test use is analysis of the variance, which is ANOVA. And ANOVA usually used to detect the differences between the continuous variable among three groups or more, three or more. Okay, what are the answers that we have? Multiple linear regression. Regression mainly use a prediction, a test used to predict between two continuous variables. Between, for example, chronic pain, patients with a chronic pain, or for example, beta amyloid 42 and mini mental state examination score. So here continuous variable and here continuous variable. So there is a prediction, is the level of beta amyloid 42 predict the score of mini mental state examination or not? This is the linear regression. Chi-square test is used to detect the differences between three groups or more, but for a variable. As I said, the first thing is to detect what type of the variable. If it is categorical, not continuous, for example, yes or no, presence of beta amyloid protein or none among mild, moderate, and severe dementia, in that case chi-square is used. So it is used mainly for categorical data among three groups or more. On Bayer t-test, it is independent t-test also. It is used to detect the differences between the mean of beta amyloid 42 between two groups. If it is more than two groups, three or more, we cannot use this because this will lead to an increase. We can use this, okay, but this will lead to increase the number of errors or the systematic error and biases. So just we use single test, and ANOVA for three groups is enough. Bayer t-test, when I do something, a measurement at the same group before and after the measurements or intervention, this is what we call Bayer t-test, the same participant. Analysis of the variance, the answer, correlation, the strength and association of association between, not the prediction, just correlation between two continuous variable. This is positive correlation and this is negative correlation. And if there is no correlation at all, the line will be like this between continuous variable and continuous variable. Thank you.